We spent the last 60 years showering money on a hospital-based and highly technological system to the tune of nearly $1 trillion a year. The hospital sector makes up 6% of GDP, $851 billion. That's bigger than mining, oil, and gas extraction. It's bigger than agriculture. It's bigger than computer and electronics and computer products. It's bigger than automobile manufacturing, all of those combined. The hospital sector alone. So it's no wonder that we lack the community-based infrastructure that we need to care for the elderly and the frail and the dying. And no wonder we have starved primary care. We are the only developed nation where the ratio of specialists to primary care is 3 to 1 rather than the other way. And is it any wonder that despite all the money that we have poured on this hospital-based, highly technological, highly specialist-based system, that Americans are getting less and less healthy? So these are just a few of the reasons that what we are doing today here matters. And what you do when you walk out that door will matter in the days and weeks and months and years ahead. And it matters to your communities, it matters to your nation, and it matters to your patients. What you're doing today matters to the man I know whose daughter was actually the head of the National Patient Safety Foundation, who ended up getting an unnecessary colectomy when he was 86 years old. And he got C. diff. And if you don't know what C. diff is, you'll learn about it soon enough. He got C. diff, and he spent the next 6 months with intractable diarrhea, and he never left the nursing home. He died. It matters today to the woman who went to the emergency room with a pulled muscle and ended up getting an unnecessary cardiac CT that led to an unnecessary catheterization, that led to a perforation, that led to a bypass, that led to her having to have her heart transplanted. It matters to my family because nothing I could do and nothing I could say could hurry my father out of the hospital, where he got nutrition that he didn't want, where he got a stress test he didn't need because it wasn't going to make a difference in his treatment, where he got blood test after blood test and he was asked question after question when all he really wanted to do was go home. And when he finally did go home, we were able to care for him as he died. So what you're doing today matters to every patient who's been overtreated, overdiagnosed, overtested, and overwhelmed. But it also matters to the patients who aren't getting care that they do need. Like the big muscular construction worker who broke down in tears when he told my friend in her exam room that he couldn't afford to pay for the diabetes medication that he needed. And what you do today matters to the woman I know who had breast cancer, who was getting chemotherapy treatment, and she was at the doctor's office at the oncologist, and the needle was already in when the nurse said, "Has your insurance status changed?" And it had. She'd lost her Medicaid. And the doctor said he was sorry, but he couldn't treat her. And what you do when you leave this room will matter to your profession. For those of you who have already begun your clinical rotations, how many have begun clinical work again? So you've seen incredibly good and compassionate and caring physicians and nurses. You've seen really good care. But you may also have come across the other side of modern medicine. You've encountered cynicism and bitterness. You've seen exhaustion and resignation, especially in primary care. We can't let cynicism win. We should weep when young doctors and nurses perceive the gap between the idealism that drove you into medicine and the reality of an increasingly industrialized and commoditized healthcare system. You have been inducted into a league of moral actors. You've pledged your lives to the care of others, and that is an incredibly humane and human thing to do. In exchange, you will be granted a front row seat at the lives and deaths of your patients. This is an incredible gift, and it's going to mark you for the rest of your lives. You'll remember patients that you encounter over these 4 years and over the years to come. Some of them will haunt you, and some of them will bring you great joy at the memory of what happened. And trust me, your patients will remember you. You are the people we need as patients, to truly care about us as well as for us. And we cannot allow you, our greatest resource, get beaten down by the cynicism and despair that is out there and the system as it's currently organized. We have to fix healthcare. We simply must. And it is fixable. And today I stand before you filled on the one hand with dismay about the system that is, and also on the other hand with great hope. I have great hope because all of you have chosen to be in this room on this day with AMSA, which is an organization that has already changed the face of healthcare for the better, and it is capable of much, much more. Together, we can begin on that road to changing healthcare by imagining a better system.